Hello, my name is Andrea Hudson. I'm a senior at the University of Phoenix online. I am completing my master's program for nursing, and part of that program involves completion of a practicum. The title of my practicum is Post-Mortem Care, and what I'm going to do here with this project is perform post-mortem care on this patient that has died. The doctor has officially called the time of death as being 9:47 a.m. and that's the time that has been documented. The family has came and they have viewed the body and performed their rituals, and now it's time for me to prepare the body to go to the morgue. Part of that preparation involves getting a shroud kit. A shroud kit is a post-mortem bag, as you see here, and it comes in various sizes for the type of body, the age, or the size of the body that you're going to use. The patient is placed on a pad, and I will perform a washing of the body to make it to make sure that there's no odors and that all the tubing is disconnected before the body is taken to the morgue. So now I will glove up and wash the body. If this patient had any dentures or anything, I would also take those out, dentures and eyeglasses, and put them in a personal belongings bag, and that would accommodate or accompany the patient to the morgue. So first thing I'm going to do is wash the face. Now the body. Okay. I'm going to dry the body as well. I'm going to attach what's called a toe tag to the toe with the patient's name, medical number, and room number, the name of the physician, the hospital, and the time and date of death. I've also attached a tag to the outside of the shroud with the same demographic information on it. Now, since this patient's mouth is open, I'm going to close his mouth and take a string here and tie it. Now the patient doesn't have any invasive lines. They've all been removed and DC'd. Had the patient had some invasive lines and the family requested an autopsy, I would have left those lines in place, okay? But since the family has not requested an autopsy, those lines have all been removed and the patient is ready to be taken to the morgue. So now I'm going to close up the patient's body inside of the shroud, like so. Shroud kits come with everything you need. And then I'm going to zip it. Okay, since this is a kind of large shroud, and I fold it over like so. And I have these strings here left, and the instructions on the shroud tells you to tie one string at the bottom where the feet are, one midline where the waist is, and one around the head, well, where the neckline is. Now the body is ready for transportation to the morgue, where it will be kept in a refrigerated area until the mortician comes to claim the body. Thank you, and that concludes my presentation for post-mortem care for nursing 590, University of Phoenix, online.